Hi, this is Dr. Jin Sung, and I'd like to welcome you to the Dr. Jin Sung show. I am not a web star, so I will be mumbling through this because this is live. I've never done this before, but what I like to do is get out the message to the patients out there and the community that there are alternatives to all your chronic health conditions and illnesses, which you take medications, probably 3, 4, 5, or 6 of them all the time. Now, my name is Dr. Jin Sung, and I'm a chiropractic physician by licensure, but my specialty is in chiropractic, functional neurology, functional medicine, and pretty much functional anything. What we're trying to do is restore health to the individual and not just mask over or cover over things in the traditional sense. So if you have pain, you take an ibuprofen. If you have diabetes, you might take metformin. But in our office, what we're trying to do is try to get to the underlying cause of your illness. What is driving your diabetes? What is driving your autoimmune disease? What is driving Hashimoto's thyroiditis or rheumatoid arthritis? What are the common triggers that cause patients to fall ill? Now, if you look at the statistics here in the United States, really chronic health conditions are poorly managed. I mean, there are 1 in 2 individuals who have cardiovascular disease, 1 in 2 women who have cancer, 1 in 3 men have cancer, 1 in 3 have diabetes, 1 in 3 women have depression, 1 in 6 couples are infertile or can't have babies. So they go through extraordinary measures just to get pregnant. It's become an epidemic. I mean, if you look at it, 1 in 6 couples are infertile or can't have babies or have difficulty having babies, and they go through this extraordinary measure to get pregnant. And then the other statistic on the flip side is 1 in 6 children have neurological or developmental issues. ADD, ADHD, Asperger's syndrome, you name it. There are a million different conditions that ail the patients here in the United States. And all the common triggers that we think about for these chronic conditions are very simplistic. It starts with the basic concept of food, what we put in and what we absorb, and then what we excrete. Okay? If you're not eating healthy, you might want to start just by cooking your foods. Instead of getting the boxes, the pizzas, the pastas, think about just cooking your food. If you just went down the grocery aisle and you stayed on the outside of the supermarket, you look at your fresh fruits, vegetables, and just cook your foods. It's very simple. There's an epidemic number of conditions that are being affected by food. So one of the most common things, or what they consider a fad at this point, is the gluten-free diet. Now, I know there's probably a lot of people who are trying gluten-free diets and saying, this is making me feel better. My stomach is not as bloated, my joints are not as stiff. I just feel overall a little better. And the reason is gluten is a hybridized protein. So it's wheat that's been hybridized to the point where it's not the wheat that we used or ate way back in the ancient times. So therefore, the Americans here in the United States have more digestive problems. They have more gluten sensitivity. So there's a distinction between full-blown celiac disease, where people have, blunting of the microvilli, and they have significant GI symptoms and so forth, and they may take 3 or 4 years to get diagnosed properly because you go to one doctor, they go, oh, you take an antacid. Go to a different doctor, oh, it must be you need a stool softener. You go to a different doctor and they say, it's just all in your head, maybe you need to see a psychologist. It all depends on who you go to, where their specialty lies, and that is the medication that you will get. What I'm saying is, gluten in itself, because it's hybridized and it's used in a lot of different processing materials for food. I mean, if you look at the back of a box, you're going to see gluten everywhere. Okay? Any food product that you see is almost always full of gluten. And the reason it's so bad for our health, especially if you have a chronic condition, is that the gliadin protein, okay, in the gluten can be detrimental to our health. What do I mean? Well, the gliadin can get into our GI tract and cause inflammation. It can break down the gut barriers of our system. If it breaks down our system, then the gut barrier is broken, and things that should not cross into and get into the rest of the body starts to get there. So larger proteins will start to cross into the bloodstream and cause more inflammation. More inflammation basically means if we have more pain, we have more neurological disease, we have infertility, we have all these things that go on. If you really think about it, one of the most common complaints of patients is that they're fatigued all the time. They're chronically tired because they're inflamed. Most patients are inflamed. They come in and they're eating foods that are processed, it's inflaming their system. The food system is basically full of sugars, full of dyes, full of preservatives, and it inflames our system. If you get inflammation of your entire GI tract, it will lead systemically and it will go and break into the brain area, causing fatigue. So fatigue is a very big problem here in the United States, and there can be a very simple solution. Eliminate some of the foods that cause inflammation. Gluten, soy, dairy, lectins, nightshades. If you can remove those 5 food products, you may start to reverse your chronic health conditions. Now, I am not an expert in anything. I would say I'm more of a jack of all trades. What I'm trying to do is take pieces of our system, look at it from a big picture standpoint, and say, what is going on? What is affecting our pancreas? What is affecting our GI tract? What is affecting our liver? And in essence, I don't treat anything in our office. Okay? What we do is restore health, gut ecology, liver function. So if you can restore just the natural mechanisms that are able to help you heal, then you will do better. It's very simple. It starts with the food. That is your foundation. If you could clean up your diet, your health will start to reverse. Okay? And if you'd like to learn more about what we do in our office, you can go to www.drjinsung.com and you can sign up for newsletters and so forth. Really, it's very simple. Start with the food. Start cooking at home, and you'll start to notice changes in your health. Okay? Now, if you like to like the video and share this video to other friends of yours, that would be great, because what I'm going to do is every Tuesday I am going to deliver a nugget of health to you at home. Okay? It will start changing your life. It will start changing how you think about healthcare, and it will start changing your perception and outlook in life. Okay? So I really want you to like this video and subscribe and share it with other patients or other people that you know, so we can get the word out and the message out about all the different alternatives that you can reap the benefits of if you just have the knowledge. And we're going to try to deliver high quality content that will change how you feel about yourself and your health and your outlook. Okay? Have a great, great day, and we will see you next Tuesday. We're going to do it every Tuesday at 12:30 live, and you can always go back and look at it. Okay? Have a great day.